You're watching Parker Success Academy Clinical Rounds with Dr. William E. Morgan.
Hello, I'm Dr. William E. Morgan, and this is Clinical Rounds, where we explore insights into clinical practice. Today I have a very special guest, Laura Morgan. Laura, thank you for joining us today.
So happy to be here. Thank you for having me.
So I guess we should get on the table that we're not related, even though we share the same last name, but I've known you for nearly 20 years. So,
Amazing.
In fact, we trained martial arts together a few years ago. So today we're going to talk a little bit about, now you can tell us a little bit about your background and your story. What is your specialty?
Sure. So I had just graduated with my master's in speech pathology and a concentration in oral habilitation in 2012. And then I was halfway through my clinical fellowship, which after you graduate with your master's in speech, you do a 9-month fellowship to earn your clinical competence certification, and then you're a full-fledged SLP. So I was halfway through that when I put on pause all the Christmas preparations that were less than a week away, and my job, and my parents and I were on our way to North Carolina for my grandmother's memorial service. She had recently passed away. And we were buckled, of course, and a momentary lapse of attention of the driver, and our car drifted off the side of the road and hit a parked 18-wheeler semi-truck. Yeah.
Wow.
And providentially, I believe, there were, that exact moment, driving in the opposite direction, 2 off-duty nurses, one of whom is an intensive care nurse. So they providentially were the first responders. They pulled over and ran across the road through past the median, and they knew how to hold my neck in the medial position so I could breathe. I know that any well-intentioned stranger easily could have killed or paralyzed me. I don't want to get ahead.
Oh, no. So your injuries entailed a broken neck and a traumatic brain injury.
Yeah. Later, after we had scans and testing done, it was found that I had sustained a moderate severe diffuse axonal traumatic brain injury. I had broken C1, C2, the atlas and axis, highest vertebrae in your column. I'd broken my jaw, some ribs from the seatbelt, which is a minor deal in the scheme of things. My mom in the front seat, again, everyone was buckled. My mom broke, I think it was 11 ribs from the seatbelt. And she also sustained a brain injury, a mild one. And she and I were both knocked unconscious.
So axonal injury, of course, is when, of course, there's a sudden deceleration and the axons basically shear off, usually where the gray matter and the white matter meet. Is that correct?
Yes.
So then that, if it's diffuse, it's usually pretty bad. If it's diffuse enough, it will cost you your life or ability to have cognitive abilities. So you went through this, or you're trained to help people who've had brain injuries and had neurological disorders, and then now we'll go through the very long process. How long did it take you to recover?
Oh, I think there shouldn't be a past tense to that verb. I accept that it's now going to be a lifelong venture process, but initially I was in 3 different hospitals for a total of 72 days, none of which I remember, like the time you went to the moon. Don't you remember that big event? So 72 days in hospital, and then several years where my full-time job was participating in completing outpatient therapy.
But eventually you were able to get back and complete your residency, and now you're practicing speech pathology.
Yeah, through a longer process. I completed several hundred hours of just volunteering as a Red Cross volunteer in several departments, including the speech pathology department of Walter Reed National Military
So
Medical Center.
I used to be, we used to have a service line where I was joined with that at once upon a time. So that's great.
Right. And
So,
I remember one time when I was on my way about to go up the elevator, I remember seeing you. And
oh,
it was
that's right.
like, Dr. Morgan.
Yeah, that's back when I was. So I've only been here 6 years. So again, I know you were eligible for care at Walter Reed and Bethesda Naval Hospital. So again, long process, but eventually you're into clinical practice now. Is that correct?
That is right. Yeah, after about several hundred volunteering hours, I was giving a presentation at the Brain Injury Association of Maryland, their conference, yearly convention, and a question from the audience after one of my presentations changed my life.
How so?
The person asked, are you going to finish your clinical fellowship? And my kind of smart aleck answer was, I don't know, are you going to give me one? And that's exactly what happened. Later, I would find out that hand belonged to Mr. Thomas Krzwolski, who was at that time the speech pathologist of the senior speech pathologist of the Head Injury Rehabilitation and Referral Services, HERS, where I started as a cognitive rehabilitation assistant, and then I restarted and completed my clinical fellowship, and have stayed on there. Now I am the speech pathologist of HERS.
Wow. Now, during your journey, did you have dysphagia or aphasia from your brain injury?
I did not have diagnoses of those two things. I completed tons of speech pathology, working on cognitive linguistic skills, mostly executive function, things, attention, memory, reasoning, those skills.
Are those all part typically of a speech pathologist's therapy and training?
That is within the scope. I have chosen that to focus on as while I was doing my fellowship at HERS, I decided to go ahead and complete the brain injury specialization. So that is truly my bread and butter now.
So through the process, and where I really want to go with this interview is you dealing with people who are so frustrated with their injuries and overcoming it, and you're trying to coax them along, but you've been through it yourself. What can you share with the docs and the therapists out there who've not had a brain injury, as they're trying to help someone who was in your shoes 10 years ago?
Great question. There's so many things, and I will condense it now, but I could easily go on, and I have gone on and on in presentations about that. One point is that to keep in mind that memory loss may prevent a client from celebrating and even recognizing their progress. Like independently using compensatory strategies to recall a scheduled event, initiate a social interaction. Those are big wins, but, and even learning or progressing from a wheelchair to a cane, that's huge. I did not recall having been in a wheelchair, being limited in that way. So when people would try to encourage me with, look how far you've come, which is great. But at the time, it was just, to me, there was no progress. What I remembered was running half marathons, rock climbing, and now I was supposed to be celebrating walking with a cane. I wasn't able to recognize that. So I think that's a really important thing for medical professionals to keep in mind, that keep in mind the client's baseline. What do they perceive as the baseline?
Now, what we do at our neuro center and some of our clinics is for like people with motion disorders is we use a kinetisense camera, basically a motion capture camera, so we can show them, let's for like your range of motion, because they'll say, well, it still hurt, they'll come in, my shoulder hurts. They go, doc, it's not getting any better, it still hurts. And when they see, no, actually, you're doing far more now to get to this, it's like, oh, I get it now, because we have a very short memory. Of course, if you have a cognitive dysfunction or impairment, it's really going to be difficult. So do you recommend like showing them pictures or taking pictures of them as they progress?
Yes, and that's so exciting that you have that ability. That's exactly what I'm referring to. And of course, you do have to take into account the client's emotional ability to handle seeing those pictures or video clips. But yes, that's exactly it. I suggest or recommend showing data sheets from baseline, just to show, wow, look at how far you've come. Yes, I think it's important for us as medical professionals to remember clients' baselines and their self-perceptions. There's kind of a funny story in my family that points this out. My mom and sister had put up a sign for me, reminding me not to try standing without calling for help. And lo and behold, one time I decided to stand and I fell, and a family member came and they were like, "Didn't you see the sign?" And I was like, "Yeah, I saw it, but I didn't think it applied to me." Which, sounds silly, but I think that's an example of the self-perception of, at the time of the accident, I'd been an athlete. I'd been training for a Tough Mudder, and I was like,
yeah, you're very athletic.
I was capable. So seeing a sign telling me to ask for help before I stood up was, I would just assume, no, that's not for me, clearly.
So as the years have gone by, has your memory improved? Can you remember being in a wheelchair, or just see pictures remind you?
That's a good question. My memory has certainly improved drastically, but there is a big chunk. I would say, well, certainly the 3 months I was inpatient, but then also comes in and out, is not good, I think, for probably about a year. So I don't remember being in a wheelchair. I remember a little bit of using a cane.
Are you doing things now to stimulate the neuroplasticity to enhance your journey? And if so, what are you doing?
I have discovered recently, as you can see on my forehead, that I've been made aware that balance is more of an issue than I would previously.
Oh, did you bop yourself?
Yeah, this was on my first backpacking trip. That it was great. It was wonderful, except for a water crossing where balance was already just thrown off a little bit, and I fell, and there happened to be a rock right there. Thank God I did not lose consciousness. I, had bled a lot, but no post-traumatic amnesia. Everything was pretty good.
So moving along, there's certain things you can do. There's certain drugs that impair neuroplasticity, and other things promote it, like autophagy fasting, exercise, getting enough sleep. I imagine your brain hygiene has been a lot. You have to have a system. And you said you're using aids. Are you using like an iPhone or an iPad to organize your life? I know that was really big with occupational therapy at the hospital for brain injury patients.
Yes, absolutely. I am passionate about compensatory strategies. Here's my iPhone, and I started a group at HERS where I work that's called Compensatory Strategies because I am obsessed with their role in the process of rehabilitation.
So there's a point where we want to get people's best as far as we can, but also you have to compensate for things that might be a permanent impairment, or even if it's a temporary impairment. You compensate with a cane, but also for memory, like if you're having trouble with memory, use the phone, the calendar feature, use all those reminders, the alarms to get along. What are other aspects, or are there apps that you use in your phone to help you to compensate?
Good. I take a lot of pictures. Every time I park somewhere that is not right outside the house, if it's in a big parking lot, I take a picture, and I often record in the notes section. I'll say, I parked by this elevator in front of the exit.
I do the same thing.
Good for you. Good for you. And that is something I point out a lot frequently in my group, Compensatory Strategies group, is that everyone uses compensatory strategies, some more than others, but it's great. Everyone benefits. So I take a lot of pictures. I am very consistent about using my Google Calendar and then setting alarms. I use all the features. I have my calendar send me prompting emails or pop-up messages with people's names. There are a whole bunch of compensatory strategies for recalling names. Associations. One of my favorites is taking the first letter of someone's name and trying to ask them even for an association. So my name is Laura. What could be an association for you that starts with L? And maybe I could say laughing because I like to laugh, or lunging. I really enjoy working out. Associations like that are great tricks that any of those strategies, I accept that they're going to be a permanent necessity for me, which initially I think I found somewhat discouraging because I previously had the mindset of like, oh, okay, if you work really hard, you can achieve that goal and you won't need that strategy anymore. I accept now that that's probably not the case with brain injury, but who cares? If you can accomplish great things and you're independent in using the strategies, go for it.
Well, Laura, thank you for joining us today. It's been very insightful and we appreciate hearing from you. You've been listening to Laura Morgan, and this is Clinical Rounds.
Thanks for watching another episode of Parker Success Academy Clinical Rounds with Dr. William E. Morgan.